Hello, everyone, and welcome to today's lecture on the discussion of personality disorders. In this video, we're going to take a short discussion to break down what personality disorders are and how they develop, how they are categorized in the DSM-5 TR, and what they look like clinically. Okay. We will also examine differential diagnosis and treatment consideration. So, what is a personality disorder? Personality disorders are enduring patterns of inner experiences and behavior that are inflexible, pervasive, long-standing, and cause significant distress or impairment in functioning. And is usually derived from cultural expectations in cognition, affect, interpersonal functioning, or impulse control. These are not temporary mood states or situational problems. Personality disorders reflect a maladaptive way of being that begins in adolescence or early adulthood and remains relatively stable over time. Okay. What's the theory on how personality disorders form? There's no real single cause, but research supports a biopsychosocial model. The biological factors include genetics, temperament, and neurobiology. The psychological effects and factors include things like trauma, attachment disruptions, and emotional neglect. And the social cultural factors include things like the environment, family dynamics, social learning, oppression, and chronic stress. Okay. Many individual personality disorders report chaotic, unpredictable, invalidating, or traumatic early environments. But not all trauma leads to personality disorders, and not everyone with personality disorders have trauma. Okay. In the DSM-5 TR, personality disorders are organized into three clusters. Okay. Cluster A is the odd eccentric. Okay. And that includes paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. These individuals often appear socially distant, suspicious, or even peculiar. Clinically, they may resemble features seen in uh, the schizophrenia spectrum. Okay. In cluster B, these are categorized because they're dramatic, emotional, and erratic. Okay. And it's four. There's antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. These disorders involve impulsivity, emotional dysregulation, attention seeking, and an unstable relationship. Cluster B is one of the most likely to show up in crisis settings, inpatient units, or emergency departments. And then cluster C personality disorders are usually anxious and fearful. And the three that fall into this category are avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. And these clients often struggle with fearfulness, insecurity, and rigid coping patterns. Okay. So let's take a brief look at each disorder. Okay. Let's start with paranoid personality disorder from the cluster A. Paranoid personality disorder, they usually have a chronic distrust and suspicion of others, and they believe others are trying to harm them, deceive them, or exploit them. They hold grudges. They misinterpret benign events as threatening, and often resistant to treatment due to distrust. In schizoid personality disorder, they're usually detached from social relationships, limited emotional expression, prefers solitude and indifferent to praise or criticism, and often described as loners by preference, not due to fear, but lack of interest. Okay. And in the schizotypal personality disorder, you usually find these individuals are social, have social and interpersonal difficulties. They're awkward, um, cognitive or perceptual distortions, odd thinking, odd speech. Their beliefs are kind of odd, like magical thinking. On a spectrum with schizophrenia, but without the psychosis. Okay. In cluster in cluster B, let's look at those. And you have the antisocial personality disorder, and it's the disregard for the rights of others, deceitfulness, manipulation, very manipulative, impulsivity. Uh, they have a high risk of taking risk taking behavior, criminality, have a lack of remorse, and they must be at least 18 and over with evidence of conduct disorder before the age of 15. Okay. Um, Borderline personality disorder, they have instability in relationships, uh, instability in their self-image, and they have instability in their emotions. Uh, Chronic fear of abandonment, impulsive, they do self-harm, have suicidal gestures, emotional swings, uh, intense anger outbursts, identity disturbances. Uh, with histrionic personality disorder, they usually have a lot of attention-seeking behavior. They're very dramatic, flamboyant, rapidly shifting their emotions, wants to be the center of attention. Uh, their speech may be uh, impressionistic and have a lack of detail. Okay. When it comes to narcissistic personality disorder, they have a sense of grandiosity and entitlement. They need admiration, lack of empathy, can appear very arrogant, but fragile self-esteem underneath. Okay. In cluster C, the avoidant personality disorder, they have extreme social inhibitions, hypersensitivity to criticism, avoids relationship due to fear of rejection, and they're similar to social anxiety disorder, but more global, lifelong, and identity based. Okay. The dependent personality disorder, excessive need to be taken care of, difficulty making decisions without reassurance, submissive, clingy, fears of abandonment, and high risk for staying in abusive relationships. Obsessive compulsive personality disorder is a preoccupation with order, preoccupation with control, have a sense of perfectionism. They're very rigid, they're inflexible, difficult delegating things. The difference between obsessive compulsive disorder, because no true obsessions or compulsions, is personality based and perfectionism. Okay. Um, Borderline personality disorder is different from bipolar disorder. Borderline personality disorder has rapid emotional shifts and triggered by relationships or abandonment. While bipolar disorder, the episodes of mood changes is more like longer, could be weeks. right? With borderline personality disorder, it's instantaneous. And it's not tied only to interpersonal events and bipolar, okay? Schizotypal and schizophrenia, schizotypal has odd beliefs, but not lose contact with reality, okay? Avoidant personality disorder and social anxiety, the difference between that is social anxiety is performance based. Avoidant personality disorder affects their identity and all relationships. Okay. Um, Personality disorders are heavily stigmatized. Many clients feel misunderstood or blamed for their symptoms. And it's very important to remember people with personality disorders are not manipulative or difficult, they are struggling. Trauma and invalidation are common in their histories. Diagnosis should be done carefully and not used to shame or punish clients. Okay, so that's a brief talk about personality disorders. And if you have any questions, we can get more detailed. All right.